Thank you for listening to Depictions Media Radio. Welcome to Policy and Rights, the show about government policy and human rights. And welcome back to Policy and Rights here on Depictions Media Radio. And the WHO had its first press conference for 2022, and it is dealing with, of course, COVID-19 and China. Yesterday, January 3rd, 2022, the WHO and health administrators in China did have a meeting discussing what is going on. And Dr. Tedros had this to say: "We continue to ask China for more rapid, regular, reliable data on hospitalizations and death, as well as more comprehensive real-time viral sequencing. The WHO is concerned about the risk to the life in China and has reiterated the importance of vaccination, including booster doses, to protect against hospitalization, severe disease, and death. This is especially important for older people, those with underlying medical conditions, and those who are at high risk for severe outcomes." So, the press conference is, while it is dedicated mostly to what's going on in China, there are other things that they're going to be asking about COVID-19 as there are surges happening around the world. In the northeastern states of the United States, there are surges happening there, and there, of course, will be questions asked about that. And there will be other questions asked about global travel and what is testing a travel restriction, or is it not so much a restriction as a precaution to make sure that certain diseases aren't moving from one country to another? And that is one of the questions will be asked and answered in this current press conference. So why don't we move forward into the WHO January 4th, 2023 press conference, as they discuss what is happening around the world with COVID-19, the pandemic, and other global health issues.
Global health issues at WHO. Simultaneous translation is provided in the 6 official languages: Arabic, Chinese, French, English, Spanish, and Russian, plus Portuguese and Hindi. Now let me introduce the panel, and we have a strong one today. First and foremost, Dr. Tedros Adhanom Ghebreyesus, WHO Director General. To his left, we have first Dr. Maria Van Kerkhove, Technical Lead on COVID-19, followed by Dr. Abdi Rahman Mahmoud, the Director ad interim for Alert and Response Coordination. On the right side of the Director General, we have Dr. Bruce Aylward, Senior Advisor to the Director General. Then we have Dr. Sylvie Burion, she's Director for Epidemic and Pandemic Preparedness. And then we have Dr. Rogerio Gaspar, Director for Regulation and Pre-Qualification. That's not all. Online we are joined by Dr. Mike Ryan, Executive Director for the WHO Health Emergencies Program. We also have Dr. Kate O'Brien, Director Immunization, Vaccines and Biologicals, and last but not least, Dr. Ana Maria Henao Restrepo, Coordinator for the R&D Blueprint. Now let me remind you, also in the new year, if you want to ask a question following the opening remarks, please raise your hand with the raise your hand icon. And with this, let's get started, and over to Director General for the opening remarks.
Thank you, Christian. Good morning, good afternoon, and good evening. The dawn of a new year in many countries offers a collective moment for both reflection and ambition for the year ahead. Now, into the fourth year of the pandemic, the world is in a much better place than it was several years ago, due to clinical care management, vaccines, and treatments. For most of last year, COVID-19 was on the decline. Vaccination increased across the world, and there was sustained progress in many low and middle-income countries that had been left far behind in 2021 due to vaccine nationalism and manufacturing capacity being restricted to just a handful of countries. New life-saving antivirals were identified last year, which helped cut mortality further, although the rollout followed a similar pattern of rich countries first. WHO is working, as always, to improve access, and on Christmas Day announced that the antivirals nirmatrelvir and ritonavir were pre-qualified for production by an Indian manufacturer. This is the first generic version of an antiviral to get WHO approval and should lead to increased production and access, particularly in lower and middle-income countries. But despite clear progress, the threat of COVID-19 persists. There are still major inequities in access to testing, treatment, and vaccination, and ultimately COVID-19 remains a dangerous virus to our health, economies, and societies overall. Every week, approximately 10,000 people die of COVID-19 that we are aware of. The true toll is likely much higher. We are really concerned about the current COVID-19 epidemiological picture, with both intense transmission in several parts of the world and a recombinant subvariant spreading quickly. In recent weeks, there has been increasing reports of hospitalization and health system pressure, particularly in temperate regions of the Northern Hemisphere, where respiratory diseases, including flu, are also circulating. In the last week, WHO held a high-level meeting with counterparts in China to discuss the surge in cases and hospitalizations, and subsequently WHO's Technical Advisory Group on SARS-CoV-2 virus evolution and the COVID-19 Clinical Management Expert Network groups both met with Chinese experts. We continue to ask China for more rapid, regular, reliable data on hospitalizations and deaths, as well as more comprehensive real-time viral sequencing. WHO is concerned about the risk to life in China and has reiterated the importance of vaccination, including booster doses to protect against hospitalization, severe disease, and death. This is especially important for older people, those with underlying medical conditions, and others who are at higher risk of severe outcomes. With circulation in China so high and comprehensive data not forthcoming, as I said last week, it's understandable that some countries are taking steps they believe will protect their own citizens. This data is useful to WHO and the world, and we encourage all countries to share it. Data remains essential for WHO to carry out regular, rapid rapid and robust risk assessments of the current situation and adjust our advice and guidance accordingly. Outside of China, one of the Omicron subvariants originally detected in October 2022 is XBB.1.5, a recombinant of two BA2 sublineages. It's on the increase in Europe and the US and has now been identified in more than 25 countries. WHO is following closely and assessing the risk of this subvariant and will report accordingly. COVID-19 will no doubt still be a major topic of discussion, but I believe and hope that with the right efforts, this will be the year the public health emergency officially ends. In other good news, Ebola in Uganda has not been detected since 27 November. If this holds, there are no cases by 11 January, the outbreak will be declared over. The last years have been tough on our collective health, but I remain confident and steadfast in the belief that only by working together can we harness and share science, deliver solutions that save lives, and build solidarity to counter the health challenges we face. This year also marks the 75th anniversary of WHO's creation, and we will be sharing more in the coming weeks and at the WHO Executive Board about our plans for this historic year. Happy New Year, together. Christian, back to you.
Thank you very much, Director General. And with this, we open the floor to questions. I see a couple of hands up already. Again, please raise your hand with the raise your hand icon if you want to get into queues. We start with Carmen Palm from Politico. Carmen, please go ahead and unmute yourself.
Thank you so much, Christian, and Happy New Year to everybody. I just wanted to get an update on the clinical trial for the vaccines in Uganda. What's been happening over the past few weeks, and how is the fact that there have been no new cases detected since late November impacting those clinical trials? Thank you.
Thank you very much. And I think with this we go to Dr. Mahmoud. To Anna Maria Restrepo first. Okay, let's go to Anna Maria Restrepo, coordinator for the R&D blueprint.
Okay, good morning, good afternoon, everybody, and thank you for the question. As Dr. Toro says, the main objective of the Ministry of Health in Uganda of WHO was to stop the transmission of the outbreak. Outbreaks provide us with a unique opportunity to evaluate the efficacy of candidate vaccines, and working with the researchers in Uganda, the developers, and several partners around the world, we prepared for the implementation of a Phase 3 vaccination clinical trial together with aims to evaluate the immunogenicity of the vaccine. As we reported before, the trial was organized, the approvals were available, and it was done in record time, 79 days to be precise. Unfortunately, there are no more cases of Ebola, and so what we are doing in collaboration with all our partners in the scientific community is to looking at three aspects. First, what is the best way to proceed with the doses of candidate vaccines that are now available in Uganda in a way that we conduct research that advance our understanding of these vaccines. Number two, how we can work together with the international community and the developers to ensure that the next time we have an outbreak, we have more data on the safety, immunogenicity, and efficacy of these candidate vaccines, so that they could be evaluated more easily in the context of the outbreak, or perhaps deployed with additional data collection. And third, we are also preparing and discussing with the regulatory authorities, both in the countries where these vaccines have been developed, but importantly, in the countries where the vaccines will be deployed. And to achieve this goal, we have organized a consultation on January the 12th, next week on Friday, that is open to everybody, where these points will be considered. I just want to say that it's important for people to bear in mind that when you have a disease with very high mortality, like the Sudan Ebola virus, where about 60% of the people infected could die, and in the context of outbreak, we are we develop clinical trials, and we have the expertise and the colleagues and the researchers on the ground to conduct trials. If the outbreak is declared, as Dr. Toro says, over on January the 11th, that the challenge for all of us in the international community and WHO is set up to take the lead on that and to help people to move forward, is to advance the evaluation of this vaccine so that the next time we have an outbreak of Sudan Ebola virus, we not only have the candidate vaccines in the vials, but we also have collectively as much information as we can on their safety, immunogenicity, and efficacy, so that they can be either in a position to have regulatory authorization or be deployed without incremental requirements in the field. Thank you.
Thank you very much, Dr. Restrepo. And I see Dr. Michael Ryan maybe wants to come in.
Just to reiterate what Anne-Marie said, we need to thank our multiple partners who worked with us through this whole process. I think we've taken a huge step forward. The fact that the control measures been put in place by the Ugandan government, WHO, and other partners have worked so well is a positive thing. Having the vaccines ready to go gave us a massive contingency plan if that had not worked out. But we do need to increase the speed at which we can get clinical material, clinical vaccines to the field. But that's, I think, the challenge, Anna Maria, moving forward, is to really work with our partners. And we again like to recognize our partners in Sabin Vaccine Institute, the Oxford Vaccine Institute, SII in India, the BARDA in the US, our colleagues in CEPI and Gavi, and most importantly, our colleagues in Uganda and the leadership of the Ministry of Health and Bruce Karunga as the principal investigator down there, and all of the people who work with the R&D Blueprint for Epidemics. This has been a really solid, positive, transparent collaboration in which we've got important material to the field in time to make a difference if it was needed. And I think it's a roadmap for the future collaboration in this space, and I'm really increasing our capacity to get effective vaccines into the field quickly in the case of rapidly developing epidemics.
Thank you very much, Dr. Ryan. Next question goes to Pranas Upadhyaya from ABP News. Pranas, please unmute yourself.
Hi, Christian. Thank you for doing this and wish you Happy New Year to everyone. Am I audible?
Very well, so please go ahead.
Okay. My question. There are two questions. One is regarding the spread of the XBB 1.5 variant, subvariant. This is considered to be a very rapidly spreading variant of Omicron and considered to be evasive to vaccine. This is actually creating fear and apprehensions. So could you please clarify on this? And second thing about the spread of COVID-19 in China. About the data sharing, Dr. Tedros has mentioned about the China has started sharing the data, but WHO still expects a more rapid and check and the data sharing. So could you please share that in the next executive board meeting, will there be some consideration and expectations on that?
Thank you very much. We'll start with Dr. Van Kerkhove in the room here.
So thanks very much for the question and Happy New Year to all of you. So with regards to the first question in this XBB.1.5, so this is a sublineage of XBB, which is a recombinant of two BA.2 sublineages. XBB.1.5 has been detected in 29 countries so far. There may be more as sequencing becomes less and less available at a global level. It's difficult for us to track each of these subvariants of Omicron. So it is part of Omicron, and as you've noted, it is the most transmissible subvariant that has been detected yet. The reason for this are the mutations that are within this recombinant, this subvariant of Omicron, allowing this virus to adhere to the cell and replicate easily. And we are concerned about its growth advantage, in particular in some countries in Europe and in the US, in North America, particularly the northeast part of the United States, where XBB.1.5 has rapidly replaced other circulating variants. Our technical advisory group for virus evolution discussed this yesterday at their call, which was really focused on the circulation of SARS-CoV-2 in China, but we did discuss this subvariant in particular because it is rapidly replacing other subvariants in some countries. Our concern is how transmissible it is. It does have immune escape like we've seen with XBB, but it is another subvariant of Omicron that is in circulation. And the more this virus circulates, the more opportunities it will have to change. We do expect further waves of infection around the world, but that doesn't have to translate into further waves of death because our countermeasures continue to work. So that is something that is on our radar. The Technical Advisory Group for Virus Evolution is doing a risk assessment specifically on this subvariant, which we hope to publish in the next couple of days. But what we can say is that it does have a growth advantage above all of the other subvariants so far. We don't have any data on severity yet or on the clinical picture, but we also do not have an indication that severity has changed with XBB.1.5. But that is something that we are watching very closely through studies, and experimental studies in the lab, but also in real world data when we look at hospitalization rates around the world among people who are infected with this subvariant. So it is a risk assessment that will be coming out in the coming days by our Technical Advisory Group for Virus Evolution. I do want to take a moment to say how important it is to continue surveillance for COVID-19 around the world so that we can track these known subvariants that are in circulation, that they can be assessed, that we can understand the epidemiologic picture around the world. We've had, more than 13 million cases reported to WHO in the last month, and we know that that's an underestimate because surveillance has declined. Plus, we've had the holiday period. But more concerning, we've had a 15% increase in deaths in the last month. And again, we know that that is an underestimate because there's delays in reporting. And with the holiday period and with mixing, those trends are expected to continue. So it's really critical that surveillance continues, that we can track the known variants and that we can better assess, what is happening globally. With regards to circulation of variants in China, I should mention the Technical Advisory Group for Virus Evolution just released a statement based on a meeting that we had yesterday looking at circulation of SARS-CoV-2 in China. From the data that was presented to us from China CDC, of the sequencing that has been done in the country, most of the viruses that are circulating in China are BA.5 sublineages. But again, we need more information on sequencing around the country, those sequences to be shared with publicly available databases like GISAID so that deeper analyses can be done. It's not just a matter of knowing what variants are circulating. We need the global community to assess these, to look at mutation by mutation to determine if any of these are new variants that are circulating in China, but also around the world. So there's a lot more work that needs to be done. There's a lot more data that needs to be shared from China, but additionally around the world so that we can track this pandemic as we enter this fourth year of this pandemic.
Thank you very much. And over to Mike Ryan.
Great. Thanks, Christian. With regard to engagement with colleagues in China, we also had a meeting with high-level officials from China last week, and we thank Deputy Minister Cao from the Ministry of Health and also the Vice Administrator from the National Disease Control Authority and Director General of China CDC, with many colleagues who engaged with us on that. Maria has spoken to the TAG VE and also the Clinical Network meeting. There will be a meeting, a briefing of our missions, the WHO member states, tomorrow, and our colleagues from China will also join that. It's an overall briefing on the COVID situation globally as outlined by the DG, including very much the Northern Hemisphere situation, but there will also be specific updates on the COVID situation in China. So we thank Chinese colleagues for that engagement. However, as the DG has said, we still do not have complete data. There are certainly issues in terms of the criteria for recording and reporting deaths attributable to COVID-19. We believe that definition is too narrow, which requires a respiratory failure in association with COVID-19 to be registered as a COVID-related death. That is a very narrow definition. We know there are difficulties in all countries very often in recording hospital-related admissions and use of ICU facilities, but again, we believe that the current numbers being published from China underrepresent the true impact of the disease in terms of hospital admissions, in terms of ICU admissions, and particularly in terms of deaths. And we would like to see more data on a more geographic basis across China. We'll continue to endeavour, and we look forward to getting more information on that from our colleagues. We are pleased that more data on sequencing is being uploaded, and certainly getting more information from expert clinicians in China was very helpful for us to understand the clinical impact of the disease and the needs of the system. I do think, though, it's again worth reflecting, because there are sort of two lessons emerging from what we're seeing over the last number of weeks. One is, even if you have existing subvariants causing your problem, if you have not good surveillance, then you're late to understand the problem in terms of its evolution or impact. If you've got less than optimal vaccine coverage, you have more people likely to get very sick. And if your health system is not constantly ready and adapted to surge, then you struggle when that surge comes. And I think China is a good example, as many other situations and countries have been over the last 2 years. It's not rocket science. This is how COVID does its damage now. Poor surveillance, if you don't have good surveillance, good vaccine coverage, and a high level of health systems readiness and resilience, you're likely to suffer in subsequent waves of disease as immunity wanes or as new variants or subvariants emerge. And again, we see with XBB the constant threat of the evolution or emergence of further subvariants that may have characteristics that allow the disease to transmit more easily or to reinfect individuals previously infected or protected by vaccination. So it's very important. And also with specific reference to China, I referred to the issue of under-recording, under-reporting in terms of definitions. It's also very important, and this is a general message to the world, but a specific message in relation to China as well, that we do not discourage doctors and nurses reporting on these deaths or these cases, and that we have an open approach to be able to record the actual impact of the disease in society so that we can take the best action on behalf of our citizens around the world. And this is something in which every country has a stake. But we do recognize the increased engagement from China over the last number of weeks, and specifically over the last 10 days, and we look forward to receiving more comprehensive data through the process of the meetings that we're engaged in over the coming days. Thank you.
Thank you, Dr. Van Kerkhoff and Dr. Ryan. I should mention at this point that we just released the statement by the Technical Advisory Group on virus evaluation that was talked about. Now, the meeting happened yesterday. We just released a statement. It's out now, and it's also on our website in case you want to follow up with this one. Next question goes to Jamil Shad from O Estado de Sao Paulo. Jamil, please go ahead.
Christian, happy new year to you, to all of you there. Dr. Tedros, my question is about Brazil. And as you mentioned in the beginning of your speech, New Year is a time of reflection. So since this is the situation, could you reflect on the government of Bolsonaro for the last 4 years on dealing with the pandemic? And as obviously we understood from your, not your behavior, but your institution's behavior, was to look for the scientists, the people that were basically working on science in Brazil in order to deal with the pandemic. And now the new government has chosen as Minister of Health someone that you know very well, Lisa Trindade, and was one of the scientists that you relied on. So what is your message to the new government as well? Thank you so much. Happy New Year.
Thank you. Let's keep this short. We'll start with Dr. Van Kerkhoff.
So thanks very much for your question, Jamil, and Happy New Year to you. Yes, we know the new Minister of Health quite well, and the former head of Fiocruz. I think I'd like to comment on the one part of your question related to scientists and in fact, scientists in Brazil. We are so fortunate at WHO. One of the superpowers I think that we have is the convening of the world's expertise and scientists around the world, including scientists in Brazil. And I think one of the things that is heartening to me is that transcends any political leadership in any country around the world. We have scientists that are dedicated to their jobs, public health professionals that are dedicated to the work of saving lives, to advancing science, to working with us, to being open and transparent and working with us so that we, as the World Health Organization, can take data and knowledge and turn that into know-how, into how-to, and translate into saving lives. That's the whole goal. And so throughout the pandemic, around the world, no matter who was in power, in political power, that scientific collaboration was strong. And in fact, I would argue even expanded. Our reach into countries in terms of scientific collaboration, in terms of technical disciplines, only grew. And we expect that to continue. So a special thanks to scientists in Brazil, based on your particular question, but around the world who continue to work with us. That remains fundamental for not only this virus of SARS-CoV-2, but also for all of the epidemic and pandemic threats that are out there, the ones that we know about and the ones that will come in the future. That collaboration of trying to gather evidence and to turn that into the most robust guidance that we can is the job that we have here at the World Health Organization. So a special thank you to all of those scientists and public health professionals that are out there working every day, no matter if there's a holiday or not, to try to advance that and to try and turn that knowledge into saving people's lives. So welcome to the new government, congratulations on the role, and we look forward to working with you.
Thank you very much, Dr. Van Kerkhove. Next question goes to Naomi Grimley from the BBC. Naomi, please unmute yourself.
Hello, thanks very much. On China, the EU has offered to donate mRNA vaccines. Should the Chinese seriously consider accepting those? And then on XBB 1.5, there have been some reports that in the northeast of the US, hospitalizations are rising. Can we read anything into that on severity? I know Maria said that at the moment the data wasn't there, but is that why they are really concerned?
I think we'll start with Dr. O'Brien for the vaccines. Dr. Kate O'Brien, Director Immunization, Vaccines and Biologicals, please.
Thanks so much. I didn't actually hear a question, and perhaps I missed the question. So I wonder if it could just be repeated on the mRNA vaccines from the EU.
Yes, there have been reports that the EU have offered to donate mRNA vaccines to help the Chinese. Should they accept them?
Oh, the question is, should they accept them? I see. Okay. Sorry, I didn't understand the question. Well, a couple of things to say about the vaccines. First of all, as we know from China reporting, there are very high coverage levels of vaccination in China, and there are a number of products available in China. Most of them are inactivated vaccines. The big issue is whether or not those who are at highest risk of serious disease have had already the optimal protection from the vaccines that are available. And as reported by China, especially in the over 80-year-old age group, the coverage is not at the level that would be as high as it could possibly be. So there are very considerable efforts going on now to try to enhance that coverage. What's really important is that the vaccines, both the inactivated vaccines and the viral vector vaccines, the mRNA vaccines, are all vaccines that have had demonstrated high performance of protection against the severe end of the disease spectrum, hospitalization, severe disease, and death, when they're administered in a schedule that includes a booster dose. So the availability of supply is a key issue, and there is ample supply available. So this is really about getting vaccination to people who are not yet fully vaccinated, and especially to those who have not yet had their booster dose but have had their primary series doses. The choice of vaccine and the choice of the vaccine product, many countries have a mix of products in their schedule, and we do have recommendations about the use of mix and match schedules as well, when you can have some doses from one product and some doses from another product. So certainly a policy decision is really the remit of every country, about what the mix of products is that they want to have available in the country for providing the broadest and greatest uptake of vaccine across the population. So I just really want to emphasize that the performance of the vaccines is something that we track really carefully. And one of the issues that we do have is with the new variants that are, or the subvariants of Omicron that are circulating. Of course, we don't at this point have information about the performance of vaccines with the subvariants that are circulating. We don't have a specific reason to believe that they would perform in any different way from the other subvariants of Omicron that are circulating right now. But what's clear from that information is that getting the booster dose is one of the most critical things that people can do. And again, especially just reemphasizing what the Director General said in his opening remarks, this is particularly important for those who are at greatest risk. And that's the group that we're most concerned about, especially in situations where there's very broad, widespread transmission of the virus. Thanks.
Thanks very much, Dr. O'Brien. Dr. Van Kerkhove, please.
Yeah, so your second question around the situation in the northeast of the USA. So we don't have data specifically on severity related to XBB.1.5. And we do note, however, that there is increasing hospitalizations have been reported in the northeast part of the US, where approximately 70% or so, I should check the exact data, of sequences that are available from that part of the country are XBB.1.5. What you have to also note is that there are many other respiratory viruses that are in circulation, not just COVID-19 that is increasing around the world. We've just had the holidays, so many people came together, and so we expect transmission to increase. That will result in increasing hospitalizations. We do also have influenza that is in circulation and other pathogens that are in circulation. So we can't attribute the increase in hospitalizations to XBB.1.5 yet, but we are working with US CDC colleagues closely, and we have asked them for a detailed risk assessment of XBB.1.5 as well, just as we would with any country and any subvariants that are circulating. We need to go deeper and look at the reasons for the increases in hospitalization and determine what is happening. I will reiterate what Kate just said with regards to the vaccine. This is true for everywhere around the world. Vaccination remains absolutely critical to preventing severe disease and death, no matter where you live. So if you are out there and you are required to have, if you are recommended to have a further dose, a booster dose, particularly if you are of older age, I'm talking to my friends and family who live in the northeast of the US and everywhere around the world, please get that next dose. Really matters when you received your last dose, especially if you are in that at-risk group, if you're over 60, if you have underlying conditions, and of course we want our frontline workers fully protected. So vaccination remains absolutely critical. But further risk assessments of XBB.1.5 will be forthcoming. It will take some time for some of this information to become available, and we do expect more information to come from the US on this particular variant where it's most notably reported. But remember, this variant has been detected in a number of countries around the world, so it's important that this assessment is done using all available data that we can get our hands on.
Thank you very much. Next question now goes to Latika Book, but let me say first that we have a huge amount of questions coming in and hands up. So let's please everybody keep it to one question, and I'm also asking the panel to keep answers as short as possible because we want to go through as many as possible of these questions here that we have, or the hands up that we have. So next now is Latika Book from the Sydney Morning Herald, please. Go ahead and unmute yourself.
Thank you, Tim, and Christian, it's nice to see you. Happy New Year, everyone. Dr. Tedros, you said it's understandable that some countries are reacting in the way that they are in relation to China and imposing the pre-departure tests. But does the WHO actually endorse the imposition of country-specific COVID restrictions at this stage of the pandemic? Because it looks like it's an attempt to resolve what's basically a political dispute over China's excessive secrecy and their lack of transparency when it comes to data. And the WHO has been quite concerned throughout the pandemic about the implementation of ad hoc restrictions depending on what country was involved at the time of the variant emerging, or the other things coming out. So I just want to check your views on those two things.
Thank you very much, Latika, and we'll go to Dr. Ryan for this one.
The requirement for testing is not in itself a restriction of travel. It's important to note that the vast majority of countries who've implemented measures are just requiring testing. And that is from their perception over the last number of weeks that they did not, I think, fully understand the dynamics of transmission in China, and fears that there may be other subvariants circulating in that environment. So we said this before, I think, Maria, you referred to it many times in press conferences previously, that at the moment we don't have even sequencing going on around the world, and we don't have even reporting of those sequences. So it means that sometimes countries feel the only way they're going to detect new and potentially more transmissible variants is to be able to test people as they enter into a country. But testing in itself is not a travel restriction. It's a requirement for travel. It's not an excessive measure based on any individual country's risk assessment. Ideally, it would be much better if we had much more extensive sequencing and epidemiologic data and impact data on which countries could make a proper risk-based decision regarding what they require for travelers coming from that country. You can remember over the last 3 years, China has had very strict testing requirements for entering China. So the reality for China now is that many countries have felt that they don't have enough information to base their risk assessment, so they're taking a precautionary approach. They're applying a precautionary principle and requiring testing. I would hope that as China reports more data onto the global databases like GISAID and shares more data with WHO regarding disease epidemiology impact and the health system impact, that countries will then have more information on which to base maybe more precise, more rational policies regarding testing. Because you are right, as variants have moved around, subvariants have moved around the world, the requirement for testing has become less and less important. And in fact, what really is important, as Maria said in the previous intervention, is vaccination, and so did Kate. So we need to focus on vaccination. We need to focus on that ability to continue to do surveillance and on those resilient health systems. Travel measures in themselves, particularly restrictive travel measures, are often counterproductive. But in this case, I think the Director General was trying to indicate that at the time, and certainly at the time when his statements were made, we had relatively little information on the dynamics of transmission in China, very little information on the sequences being circulating in the country. And I think the DG's intention was to create an understanding that countries in that situation, it was understandable that they would implement risk-based testing requirement and not restrictive travel measures.
Thanks again, Dr. Ryan. Next question goes to Simon Attiba from Today News Africa. Simon, please unmute yourself.
Thank you, Christian, for taking my question. This is Simon Attiba with Today News Africa in Washington. Happy New Year to all of you. Going into 2023, I was wondering if you could talk more broadly about COVID-19 in Africa in terms of vaccination, surveillance, and these new variants. And if you could clarify why Africa still has lost fewer people to COVID in 3 years, even with the lowest vaccination rate. And on Tigray, what's the latest update there? Thank you.
Thank you. And even if there are, again, two big questions, but we'll start with Dr. Mahmoud on the African question.
Thanks, Atiba. I think a very important question, and that's the $1 million we are trying to understand more. I think if we separate, because your question had multiple aspects. One is the testing and surveillance, which has been remaining a major gap in a lot of countries, not specifically in Africa, but a lot of low middle income countries, and that has not really recovered. At the initial start, WHO, we have supported countries, we have given them PCR and a lot. But 2021 and 2022, other agencies have been supporting the member states. So testing and laboratory, after the initial investment, remains a major challenge that needs to be strengthened. That's one. The second aspect to your question about the vaccination, as COVAX have done a lot of great work, and the COVAX facility in the top 34 priority. but compared to the rest of the world, still lagging behind. So how do we bring that attention in 2023 with the spread of misinformation and disinformation in a lot of countries? I just came back from home country in Kenya, and the level of interest in the vaccination was quite shocking. So it's how do we bring that? People who were initially, when they saw the death, it was okay to take, but now vaccines are available. It's a challenge how to reach the community. And lastly, the death, I think I have a different perspective. One is I was just looking at the data coming from China, 38 deaths, but from my home country, 5,000 deaths in a country of that. There's a massive underreporting in a lot of the deaths. So as you go to rural area, when you go to either church or mosque, you'll see a lot of elderly. 3.5 years later, I visited, I couldn't see any elderly population, and that's the number, the cultural aspect, the historical aspect that the absence of elderly still have in a community, the glue that helps the older population. So my feeling, and that's qualitative, that's what I expected going back, it was really underestimation and underreporting. Yes, our older population is smaller compared to other countries in the regions of the world, but a significant number have been died during the COVID, just from my immediate families, and almost every family had that. So 2023, I think, is how do we bring back, with all the waves, XBB, Omicrons going on across the world, how do we bring surveillance, how do we rebuild the vaccination program for the vulnerable population, and support the work done by COVAX, and the whole team will be a priority. The pandemic is not over. We are seeing wave and wave, and it's not the time to drop all the investment invested in the last 2 years, but to rebuild more to prepare for the more upcoming COVID waves, but also other respiratory disease. So it's a long answer for your complex question. It's a lot of complexity, and Africa has been hit very hard like another, but the advantage as a young health population has also helped. But as we call in China and every other country, to report data in a transparent and timely manner.
Thank you very much, Dr. Mahmoud. I see Dr. Kate O'Brien has her hand up too, if I see that right.
Just a couple of things that I wanted to comment on, especially around the vaccine issues and coverage in Africa. There are many countries that have made very, very substantial progress in 2022. And I think we have to really highlight that and point out the really rapid advances that many countries have made, especially in the Africa region. At the beginning of 2022, we identified 34 countries that were at less than 10% coverage at the beginning of the year. And those have been a set of countries that have been a really intense operational support focus for WHO, UNICEF, and other partners in the COVAX effort. And many of those countries were countries in the Africa region. By the end of the year, only 7 such countries were at less than 10%. All other of the 34 had well exceeded 10% for some of them, and all of them had gotten above 10%. And I think we really have to also focus on the countries that have humanitarian emergencies or other conflict settings. The countries that remain below 10% are largely countries, not all of them, but largely countries that have significant conflict or other issues around delivery of health services. So there is really a conflation, also an important intersection of what countries are trying to do in order to increase their vaccine coverage, and the multiple health issues, economic issues, and other issues, including security issues that they're dealing with. So what's really important is that in 2023, as we enter this year, we know that the countries have significant demand plans for a vaccine through the course of 2023. We're looking at that very carefully with countries to assure that the supply that we have can fully meet their demand, and we are still in a very good supply situation, so that's good news for 2023. And most countries have significant plans for continuing the campaigns that they're doing, to advance vaccine coverage, to assure that that people are getting booster doses as well, especially those who most need them, and for integrating the vaccination services with other services that are primary healthcare services for adults. So these are all of the ambitions for 2023, and countries are fully in the lead, making their plans for how much demand they have for vaccine, getting that vaccine supply in through the COVAX facility, and through other means, and assuring that there is information, accurate information of the population, so that there is demand for those vaccines at the population level, at the community level, at the family level, especially through primary healthcare services. So a lot of work still to do in 2023. We're in a good position that supply is fully available, a rich supply available of vaccines, and countries committed to advancing towards their goals and their population coverage goals towards the WHO targets. Thanks.
Thank you very much, both. And now on Tigray, we go to Dr. Tedros.
Thank you, Christian. We were moving fast, so there was a specific question from Jamil on the government of Brazil, the new government. So I'll just say a few things, although Maria had already covered, but just one aspect only. First of all, the selection for the ministerial position is, I think, excellent. We know Nisia very well, and very experienced, very seasoned leader, and I hope she will contribute significantly. And then on the new government, I know President Lula's commitment to health. He has a very, very strong commitment to health for all. And as WHO, we look forward to working with him closely, not only in Brazil, but also globally. His inauguration was last week, I think January 1st, Sunday actually. And I would like to congratulate him and wish President Lula the best. Then on the Tigray, of course, after the peace agreement, the signing, there is progress now in food delivery, there is progress in medicines, there is progress also in both comparing the need, the huge need the region has of the 6 million population. Still, there are lots of areas that are not yet covered, but we hope that can be addressed, but there is good progress. And the other area is the services. I think in banking services, resuming banking services, resuming telecom, that's good. In a good number of, in some parts of the Tigray region, but that will need, I think, to have full coverage as well, but there is good progress in resuming basic services. I think the only problem now we see is the continued occupation of Tigray by Eritrean army. And as we speak, they're massacring civilians. They continue to massacre civilians, and we believe that could affect the peace agreement. And I think the international community should help in making sure that Eritrea respects the peace deal and withdraws from Tigray and stop the massacre. I think these are the two issues. Back to you, Christian.
Thank you very much, Director General. Now, next one goes to Chu Liu from Xinhua. Please unmute yourself.
Hi, hello, can you hear me, please?
Very well.
Thank you, Christian, for taking my question. As WHO has repeated that the definition of COVID death by China's National Health Commission is too narrow, but I've been trying to search in the all WHO websites trying to find out a specific WHO version of the COVID death, but to no avail. So could you please first clarify the latest specific WHO definition of COVID mortality? That's question number one. And question number two is that WHO has reiterated that COVID tests and sequencing have been declining worldwide, which could have led to underestimated circulation of the virus. Then what's WHO's advice on how to accurately formulate anti-COVID measures or policies based on such insufficient or inaccurate data? And also WHO's advice on how to strike a balance between making sure of the transparency and information about the outbreak and avoiding possible public anxiety and panic. Thank you.
Thank you very much. A lot of questions, and apologies if we have to go short through this, but we'll see. Dr. Van Kerkhoff, please.
So I'll start with the second part of the question, but we'll follow up and send you the definitions that we have related to deaths, the way that we characterize those, because there is some specific language that we have in there. I think in general, I think I'm going to generalize your question here about how do we provide sort of this best advice with limited information. I mean, what we're really trying to do in the fourth year of this pandemic, we know so much about this virus and the disease that it causes, but we don't know everything, and we remain humble to this. We remain humble to learning about this. What we look at in our advice is we try to provide this broad spectrum of advice across so many different technical areas. How do you protect yourself from getting infected? If you are infected, how do we prevent it from transmitting to someone else? How do we prevent you, if you are infected, from developing disease and dying? How do we protect our frontline workers so that they can provide adequate care, provide the best clinical care to patients who are infected with COVID and have COVID-19 disease? And we modify this over time. Because we don't have all of the answers, what we do is we ask individuals and we provide governments with guidance to take this risk-based approach, to look at the different layers and the different types of interventions that can be put in place. The good news is now that 4 years in, we have so many different interventions that can be used, and they can be applied, they can be adjusted over time based on the situation, based on the epidemiology, the current circulation, the variants that are in circulation, the capacities to respond, the access to the tools, the diagnostics, the therapeutics, the vaccines, the level of population-level immunity across the communities within a country based on vaccination coverage and or past or reinfection, looking at the other crises that countries are facing. And so what we aim to do is put this guidance out, and there's a number of guidance that we still have out there. And we are working with all member states to adjust their policies to deal with COVID-19 and manage COVID as a disease so that people who are infected do not go on to die in the context of everything else. And given that it's been so long that we've been dealing with this virus, it's still relatively new, but it feels like we've been dealing with this for many, many, many years. It's really only been a couple of years. We have to make sure that the way that we deal with COVID is integrated into strong, sustainable systems. So dealing with COVID in the context of other respiratory diseases like flu and like RSV, dealing with clinical care in the context of the proper care someone needs when they show up at a health clinic or they show up at a hospital, making sure that they have the right diagnostics in the context of all of the other health and non-health emergencies that countries are facing. So we aim to regularly update our advice, to modify that based on updated information. Science changes, science grows and evolves, and therefore our guidance changes. But our advice to countries also takes into consideration the other challenges that they face. How do you deal with COVID in the context of everything else? So it's a constant challenge for us, but it's all based on what we know, what assumptions we can make based on taking educated guesses, and to push all of our member states, everyone everywhere, to collect the right types of data, to share that data openly and transparently, to work with us, to challenge us, to make sure that the advice that we put out is the best advice available. So it's a constant iterative process. We're doing the best that we can. We're imperfect, we know that, but we are grateful that we have so many people that are working with us. But it is based on available information, and we have to keep pushing. In this fourth year, it is really critical that we look at the impact of COVID-19. We look at not just, what is circulating, but what impact is that having in terms of hospitalization, in terms of admissions to ICU, and we need to look at how the use of these interventions changes over time. Vaccination coverage, vaccination boosting of at-risk groups remains absolutely fundamental. So it is a give and pull, and we will continue to work with everyone and everywhere to ensure that we as an organization have the right types of information regularly so that we can make those reliable, robust, and rapid risk assessments as frequently as we need.
Thank you very much. And Dr. Mike Ryan, please.
Yeah, just to take that last part of the question, Christian, around people and information and panic and spreading fear or panic. I think this pandemic has definitely taught us, and many of us would have seen this for many years before. People are smart. Ordinary people are very intelligent, and they generally don't panic. In fact, people are fearful and tend to be more likely to overreact or panic when they get anxious because they don't trust the information that they're getting. That's when you start to have fear. That's when you fear for your parents. That's when you fear for your siblings. That's when you fear for your kids. Is if you don't actually think that what you're being told represents the true nature of what's actually happening around you. And when there's a disconnect between what you are being told and what you actually can see and what you're hearing from your friends, then that erodes trust. The state government should be the primary source of accurate, credible information related to people's health on which they can take appropriate action to manage their own risks. That's the key. The key is being that source of strong, credible information and being always prepared to tell people how things are. But at the same time, telling them how things are and what's being done about it and what they can do to manage their risk and what the government and others are doing to support them in managing that risk. So I do think we've learned collectively that transparency, openness, and the communication of credible information to people in real time results in functional responses by people. We need to be very careful not to have a perverse sort of nanny state approach where the state believes it knows what's best for people. That is not a way for any responsible government to act. And it's happened in this pandemic in various countries. So I do think it's very important that we take this lesson. People need credible, accurate information on which to base their own risk management and manage their own risks to their own health. And we trust that governments will continue to endeavour to provide the best information to people so they can continue to manage those risks.
Thank you very much, Dr. Ryan. And just to add that the classification, the international guidelines for certification, classification of the deaths, of the cause of deaths that Dr. Van Kerkhoff mentioned, we just put that into the chat, the link to this, so you should find it there. Thank you very much. Next question goes to Helen Branswell from Stat News. Helen, please unmute yourself.
Thank you, Christian, and Happy New Year. I just took my hand down because I got an answer to my question. Thank you.
That is very nice of you. Thank you, and Happy New Year. Now, the next question goes to Chantal Srivastava from Radio Canada, please.
Bonjour, can you hear me?
Very well, please go ahead.
Okay, thank you. Bonne année. I will ask my question in English, but if possible, if someone could answer partly in French so that I can use it for broadcast, I'd really appreciate. So here in Canada, we will be starting screening from people, travelers coming from China tomorrow. China has branded this measure as being unacceptable, not based on science. Earlier on, the European Center for Disease Prevention and Control said it was unjustified. I just want your reading on, people are starting to wonder here, what's the use of this measure? How efficient is it? Is it a good measure to screen people? What can we expect as far as results are concerned from this measure that will come into effect tomorrow in Canada? Merci.
We have one person who might be able to answer in French, but otherwise we'll send it in writing if Dr. Biron, we want to try?
Okay, bonne année à tout le monde.
Well, Happy New Year to everyone. Thanks for this question. So yes, it's true. Several countries have set up tests for travelers coming in from China. As Mike Ryan said, to test is not restricting travel, not directly, because people can still travel. It's simply a request, a demand that's made upon these travelers on arrival, so to make sure they do not arrive sick. In any case, when we're talking about a pandemic, individuals who are ill are recommended to not travel. It's better for them to stay at home than to transport a virus. This measure includes mostly those travelers who are asymptomatic and unwittingly might bring the virus with them. As Dr. Ryan also said, what is equally important is that this measure allows for identification of specific variants upon arrival, once again referring to asymptomatic individuals, people who would not have been tested back home. Obviously, ideally, we would like a test ahead of travel so that any potential carriers might not travel. However, it's true, some countries have set up tests on arrival, and it's quite simply another way of reducing uncertainty regarding the virus, regarding the public health impact. Since Omicron is to be found pretty much all over the world, it might not put a dent in that transmission. However, once again, the goal of these measures is, on the one hand, to reduce uncertainty, since we often don't have a lot of information on the situation in China, and on the other hand, it allows us to possibly identify new variants that might emerge in any given country. Since China is obviously a very populous country, if there's a circulation of a virus variant, it might lead to new variants due to the possibility the virus has to evolve in cases of high levels of transmission. Thank you.
Thank you very much. Merci beaucoup. Dr. Briand, next question goes to Adam Taylor from the Washington Post. Adam, please unmute yourself.
Hi everyone, Happy New Year. I just had one question. Do we have a sense in China how much the vaccines being used there are protecting against severe illness, severe disease and death? And some outside modelers have made predictions that there could be 1 million plus deaths by April. Is that within the sort of realm of credibility, or is that not what we're seeing from the data that the WHO is receiving so far? Thank you.
Thank you. I believe we start with Dr. Kate O'Brien on the vaccines. Thank you.
Yes, so there are over a dozen vaccines that are authorized for use in China. They include both inactivated vaccines and viral vector vaccines. And there is also an inhaled product that's in use in China. So I'm going to focus my comments mostly on the inactivated vaccines, which are the most commonly used vaccines. We've followed the data very carefully on the performance of those vaccines when used according to the schedules that are recommended. And when a booster dose is provided of inactivated vaccines, they perform at an equivalent level to the performance of other vaccines, viral vector vaccines, mRNA vaccines. I'm emphasizing the importance of the booster dose, as you've heard us throughout this press conference and in others, that in order to actually get the best performance out of vaccines against Omicron variants, it's really important to get the booster dose. So in terms of the performance, these are performing at an equivalent level for severe disease, for hospitalization, and for death from studies that are, some studies in China, but studies that are also coming from other countries where these vaccines are in use and where there has been more circulation of COVID. And I'll just emphasize again the importance of the mix and match schedules. It's not restricted to only being able to use one product in a series of vaccines, but full availability of recommendations to combine the use of vaccines And this breadth of vaccines that we have available are highly effective against the severe end of the disease spectrum when they're deployed to the right people in the right number of doses. And we just can't overemphasize that enough, that those who are not vaccinated, even if somebody has had infection before, get better performance, better protection when you've had vaccination, even on top of a previous infection. Thanks.
Thank you, and Dr. Van Kerkhove.
Yeah, very briefly, because I know we still have a lot of questions and more people that want to ask. So with regards to the modeling question, we just want to point out that these models are quite helpful for scenario-based to plan, but the models are not predictions of what has to happen. And I think what we have to point out is that exactly what Kate was talking about in terms of increasing that vaccination coverage. It is never too late to vaccinate. And the vaccines that are in country, that additional boost will save lives. Also, the amount of clinical care that is available in China, access to antivirals. We had a clinical management call yesterday as well, where we had discussions with clinicians across the country in terms of how they are dealing with patients, what they are seeing in terms of severity of patients with Omicron and the sublineages that are circulating there is the full spectrum, everything from asymptomatic infection all the way through severe disease and death. The disease presentation is similar to what other countries have experienced with waves of Omicron. The therapeutics are working at preventing, especially the antivirals, of preventing severe disease, but also a number of therapeutics that can be administered to those who are at risk for developing severe disease and dying can be used. They're working. So it's back to the fundamentals. Early diagnosis, access to clinical care, the use of antivirals and therapeutics, vaccination, this is saving lives. Those predictions do not need to become a reality. They are very useful for planning purposes in terms of what may be needed across the country in terms of the bed needs for hospitalizations as well as for ICU, access to oxygen and ventilation, for example, but those predictions do not need to become a reality. We just want to emphasize that. They're very helpful to get action underway, but we have many tools that are in place. Vaccination is absolutely critical to preventing severe disease, and so that's what needs to be the focus in China right now to prevent those deaths from occurring, but also we can prevent deaths that are occurring around the world. The DG just said more than 10,000 people are being reported to die each week. 4 years into this pandemic, many of those lives can be saved now with the tools that are available. So let's get acting on that and let's focus our efforts to save the lives now.
Thank you very much. And Dr. Mike Ryan is still on to add.
No, I think that's that Maria gave the answer as I would have. And remember, in this when we talk about deaths, which, particularly in relation to China, has had a relatively low death count over the last 3 years, and there have been millions and millions of deaths in other countries. And again, we need to look at expected mortality in a population of 1.4 billion over a period of months. People, unfortunately, do die in every country, and they die from all causes. The question is what the excess mortality might be in relation to this wave of COVID. And we've said it before in a number of press conferences, getting as many people, particularly the vulnerable, vaccinated right now, it's not too late, and making sure that there's adequate clinical care in place for people so they can get access to oxygen, access to supportive therapy, access to ventilation when they need it. And that comes back to the issue around having good surveillance. If you have good surveillance, if you know where the disease is, if you know where the impact of the disease is, if you know where hospital beds are becoming overwhelmed, if you know where your health workforce is at, if you have access to all of that information, it's much easier to be agile, it's much easier to be tactical in your response and be able to respond to the maximum with the resources that you have. So surveillance, again, vaccination and hospital or healthcare readiness still remain the magic solution when it comes to dealing with COVID, regardless of the wave and regardless of the subvariant causing it.
Thanks very much, both. And we have still a long list, but I think we're already over the hour, so we may get one or two more questions in, and then we may need to close, even though many people on the list, but some of the questions are repeating, so we hope we covered most of it. But we'll go ahead now with Naomi O'Leary from the Irish Times. Naomi, please unmute yourself. Naomi, you're gone? No, then we'll try the last question for Lisa Pham from Bloomberg. Lisa, please unmute yourself.
Hi, and thank you for your time today. With the record number of people getting infected in China in such a short period of time, do you think the country is getting closer to the widespread level of hybrid immunity already established elsewhere around the world? And what would the subsequent waves look like there?
Thank you very much. And Dr. Van Kerkhoff, please.
It's very difficult to get into predicting what will happen. We are seeing intense circulation of SARS-CoV-2 in China and around the world, but in China in particular right now, which is the focus. We do have both this population level immunity increasing from vaccination, and there are significant efforts underway to increase vaccination coverage, but we do see we will see more hybrid immunity, as you've pointed out, from infection and vaccination, or a combination of both. In terms of subsequent waves, I think what we have to do is we have to learn from other countries. Other countries that have experienced Omicron have seen different waves of infection, but we cannot predict exactly what will happen. It really does depend on the measures that are in place, the comprehensive approach to these different types of measures. Having people live their lives, but taking ways to reduce the spread where we can, but also preventing those severe disease and death. And there's a lot that can be done. So there is no inevitability, but we can learn from other countries and how they have experienced different waves of infection. The predominant viruses that are circulating in China that have been reported to us from the sequences that are available are these BA.5 sublineages, but with further virus evolution there and around the world, we cannot predict with certainty what will happen. We plan. We plan for more cases. Those cases do not need to translate into further severe disease if we use those tools most appropriately. So it's about making sure that the systems are agile, that they can adjust to surges, to ebbs and flows of circulation, to deal with patient care so that health systems do not get overwhelmed, and where they are overwhelmed, how they can manage the patients from COVID, but from other diseases that are circulating there as well. But again, we will work with China. We continue to work with China. We continue to work with our member states to adjust the strategies based on the current situation they have, based on the capacities that they have to deal with this, and that includes dealing with workforce issues and dealing with access to life-saving tools.
Thank you very much. And Dr. Mahmoud, please.
Thanks. Maria covered. It's very hard to predict, but what we have learned so far is the human nature and human congregation coming together, whether it's the Northeast US or the temperate region of Northern Hemisphere, people coming together, particularly very effective and safe measures like masking. I know a lot of country masking, it doesn't cost anything and it's going to save your life. And so I think the message for both China and all the people in the temperate, in this crowded zone, will all come together. It's very, very important that masking saves lives, prevent infections. And with the coming of the Lunar New Year, January 22, in China and a lot of other Asian countries celebrating that New Year, we expect people coming together may create a subsequent wave. So the preparedness that we have seen right now, the wave that's going through the urban area, how does the health authority prepare in the rural area where the health system may not be up to mark? So I think there's a lot of preparedness and lessons that can be learned from current wave that's going through major urban centers. As we come through the Lunar New Year, how did the health system prepare? And then basic measures really like masking saves life, both in those countries and all everywhere. So just that to add that part. Thank you.
Thank you very much, Dr. Mahmoud. With this, we're closing our first press conference of this new year 2023. Thank you all very much for attending and being with us. We will be sending the audio files and Dr. Tedros' remarks.
Thank you for listening to today's episode. As the WHO closed their press conference for today, and we look for more to come in 2023. I do want to say this is that vaccination is while it can be important, and as discussed in this press conference, that they're saying that it will save lives and help curb the spread of the virus for COVID-19. The social implications that have been going around for the past few years over to be vaccinated or not to be vaccinated is of serious concern. There are families who are fighting against each other over this particular topic, and there are a lot of discussions and a lot of things that are happening around it. In some cases, suppression of information, especially information that different governments don't want people to know or don't want people to talk about around the vaccination. And one thing is for certain, that it is a choice. It is a personal choice, and that there probably shouldn't be things like mandates forcing people to actually get the vaccination, and that it should be vaccination and the promotion of medications in general should be done by way of education, not by force and mandates. It isn't necessarily a democratic way of doing things. Okay, so again, we want to thank you for listening, and please do click that subscribe button to get more updates from us here at Depictions Media Radio and from this show, Policy and Rights. This show has been produced by Depictions Media. Please contact us at depictions.media for more information.